Hi, I'm Hannah, your clinical nurse specialist, and I'm going to talk to you a little bit about common medications that you may be prescribed. Domperidone. Domperidone is an anti-sickness medication we often prescribe alongside chemotherapy. It has very few side effects and can be given alongside other anti-sickness medications. You can have domperidone 3 times a day, and they are delivered in 10 milligram tablets. This is often our first line treatment for nausea and vomiting. Ondansetron. Ondansetron is an anti-sickness medication often given alongside chemotherapy or nausea related to radiotherapy. It is a very potent and effective anti-sickness medication, but does come with a common side effect of constipation. We often consider laxative medication when prescribing ondansetron, as the constipation it may cause can make your nausea and vomiting worse. This is often a second-line anti-sickness medication. Please be assured if you are prescribed this, it is an effective dose. Dexamethasone. Dexamethasone is a corticosteroid, or steroid as you may hear it. It is used frequently within our brain service. You may have been prescribed dexamethasone when you first presented with your brain tumour, as it is very effective at reducing swelling within the brain. The swelling within the brain often causes headaches, nausea, vomiting and balance problems. And so dexamethasone is very effective at helping reduce these symptoms. Dexamethasone is often delivered in 2 and 4 milligram doses, and you may be prescribed doses much higher, up to 12 milligrams a day. This will often be reduced and titrated down slowly so that you do not receive too many side effects of reducing this down. Dexamethasone is hugely effective, but does come with some side effects, especially with long-term use. If you are on dexamethasone for more than a month, I will very likely ask you to have your blood sugars checked with your GP, as it can raise blood sugars, inducing a diabetes from the steroids that we give you. On occasion, it can make your ankles and feet swell, and if you notice these symptoms, please do call. Lastly, with dexamethasone and long-term use, it can cause some muscle wastage, so we urge you to be and remain as mobile as possible whilst taking it. Dexamethasone can cause some tummy irritation, and therefore we often use lansoprazole alongside. Lansoprazole. You may be prescribed lansoprazole alongside the steroids that you're taking. Lansoprazole protects the stomach lining from the steroids that can irritate the gut. Lansoprazole is to be taken 1 hour before any food and drink in the mornings prior to any steroids that you would take. Levetiracetam, or Keppra as it's commonly known. Levetiracetam is an anticonvulsant or anti-seizure medication. It may be prescribed at presentation of your brain tumour if you were admitted with a seizure. It may also be prescribed during your journey if you display any seizure activity. Levetiracetam generally is well tolerated, but must be taken twice a day at regular intervals. In higher doses, it can cause fatigue and can affect mood, so it is important that if you feel that your mood is low, to make sure that you notify somebody so that we can help support you through this. Often, levetiracetam or Keppra is a long-term treatment and lifelong treatment for you. Other less common anticonvulsant medications include lamotrigine or sodium valproate. But should you join our service and require any anticonvulsant medication for your seizures, you will be referred to a neurologist and an epilepsy community nursing team who will go through this in more detail for you.